funding for your nonprofit or for-profit health organization? This is a topic that is like shockingly, um, it's not a lot of people who are decision makers, executive directors, you know, founders, owners, CEOs who are not always, a lot of the people I've attracted are not privy to this information, which is, you know, my ideal client, because I want to show them how they can go from 300,000 in funding or less to millions in funding. How they can tap into ways to bring in revenue consistently for their health organization. And it's not just through fundraising and it's not just through grants. There's so many other funding sources. But in addition to identifying the funding source, you have to have the stuff ahead of time. You know, there's some steps to ensure that you're attracting funding, but you don't have to have it all together at once, right? Um, but I want to talk about funding for health organizations and how they can attract it consistently, even if they have small teams, limited budget, just getting started, or if they've been around for a very long time, there's still ways to get more funding, to improve the expenses, right? Reduce expenses, improve time, efficiency, improve patient relationship or community relationship with your health organization. It doesn't matter how successful your organization is, there is opportunity for improvement. There's opportunity for you to support another organization that you see is in need of support or has a need for X, Y, Z. Um, but the 5-step community impact framework is a framework that I designed and developed after working with health organizations across the United States and individuals and professionals across the globe who work in public health and healthcare. Um, and with that framework, we've been able to identify 5 key areas, which includes many subcategories, that organizations need to have in order or thriving to ensure that their program is successful from start to finish, fully funded, and also, you know, having the participants, having the partners, just some areas. I don't want to. I can go through it. That's just a LinkedIn or it's what is it, YouTube Live. Um, so, what the first step is, I don't do a lot of stuff on DEI, but without talking about that in social determinants of health, it does make it kind of challenging to not touch on that and understand public health and the history and then also real life, what's happening now, right? So we do touch on like empathy, equity versus equality, social determinants of health. I touch on redlining. Um, I haven't. We do go deep dive into shortage areas with food or healthcare, and so that's just inside of our public health. Our community impact intensive for founders, CEOs, decision makers, who want to learn more about that stuff and improve the skills to advance their organizations and their initiatives. Um, but we do talk about equity. We talk about racism, biases, and I love talking about biases. We really go deep on that, which it's very interesting because it's one of those things we hear about where we don't really take a moment to understand. Like, there's so many biases that you might not even realize you have until you learn more about that specific bias. You're like, oh, dang, that's what that's called. Okay, I think I've, you know. So, yeah, that's the first, equipping staff and stakeholders. The second step is to track performance, right? So we need to be looking at what are we tracking, why are we tracking it, what more do we need to track, or what less, what do we need to stop tracking? Because some organizations are tracking way too much information that's not necessary, and ethically speaking, you should only be tracking data that you're going to be using for a purpose, right? Whether it's research or not, like data, no matter what type of data it is, can be considered research, in my personal opinion. So equip staff, track performance, build capacity is the third one, where who is at the table? Are you a solopreneur? Are you, what type of programs do you have in place to grow your team with a limited budget? um, because even if you are a solopreneur, there are programs out there that can help you grow your business. There are programs you can create that can have a multitude of funding sources that can help you grow your business without hiring staff as W-2 employees. Okay, so no matter how small or large your team is, building capacity is important to understand where you are as a team, who do you need with partners, internal partners, external partners, community members, nonprofit and for-profit businesses. So we do talk about building capacity, and that's a really deep topic. I love talking about building capacity because we are also able to talk about coalition building. Coalition building, very proud of. I love the work that I did around coalition building. I'm excited to help support other coalitions across the United States, globally. I do only speak English. I am learning Spanish, but we've been able to help a lot of coalitions, a good deal of coalitions, even though most of our organizations are a program, not a program, but they have a health program, not a coalition. So building capacity is the third. The fourth one is marketing effectively. And we talk about how you should be marketing in a way that is not just posting on social media, checking a box. You're actually taking people from viewer to doer. That's something that I've pretty much coined, viewer to doer. I would say I hadn't heard it prior to me saying it, but how do we take the people that we're trying to educate online or trying to get to our programs or our events? How do we take them from viewer to doer, whether it's through social media marketing that you're doing to attract people for your initiatives, or you're doing it in person, and not just at community outreach events, right? So we talk about how to market effectively online and offline to be cost effective, to be efficient, to attract the people you aim to attract. So your numbers look good for your programs, and then you can improve health outcomes. And partners are excited to fund you because they see you actually achieving the goal you set out for yourself, or the mission of the organization is successful. um, and the fifth one is all about community outreach and engagement. Community outreach, community engagement, I love talking about it. um, they are two different things. There's a lot of ways to waste tens of thousands, hundreds of thousands of dollars on ineffective community outreach and engagement. Hundreds of thousands of dollars. So we look at how to be efficient with your community outreach and engagement efforts, how to create a plan, how to create a standard operating procedure, how to make it fun on both sides that benefits the organization and the community. People don't go into all of that. I just, maybe they do, but I'm just saying, like, I go to these events on purpose, not as someone who's there for a resource, but to assess what I'm seeing. And I'm constantly confirmed, like, I'm sorry, but your beautiful design pamphlets, they should be here, but you need more. You need to do more, not necessarily have more things, to engage, to educate, to recruit, right? Maybe you don't have a program right now that you're recruiting for. Maybe you don't need donations at this moment, which who doesn't need donations? Why aren't you saving money for your nonprofit? Why aren't you saving money for your business? So with that, we talked about optimizing your community outreach and engagement. As you see, I can get really passionate because I've worked in those different areas and I help clients succeed in those different areas. And when I actually started to track the financial impact of ineffective activities, especially in the nonprofit sector where I came from, I was very like, oh, wow, okay. So I'm going to show organizations how to consistently attract funding and save funding while improving efficiency and delivery of their health programs and initiatives. And this can be for the for-profit side, the nonprofit side, particularly for founders, executive directors. I mean, people who want to start a business and, like, you know, owning a health organization, nonprofit or for-profit, but the staff and leadership are welcome, but these are for decision makers to be at. Really, the people who are seeing the budget, the people who are, you know, they're making a call right then and there what happens for their organization, so that they can see results fast. It's not about what I'm telling them to do, but what they learn and see fit for their company, and they personalize it based on our what we do inside the community impact intensive. We personalize it to your organization, no matter how big or small. We work with you throughout that 12 weeks to make sure that if you want a different approach to what you're currently doing based on what you learned from our framework, we help you personalize that to your organization so you can be successful. Um, and that's a cost of hundreds of thousands of dollars. Like outside the program, I'm charging at least 50K. So that's, and I want to have the community impact intensive because I'm able to serve a lot more people a lot faster. Um, a lot of the times it bypasses the procurement process, the RFP process. And so it's just another way for me to have a greater impact faster on both ends. Because I know, I've done plenty of RFPs. I've, done a lot of work with government and non-government organizations. And sometimes the procurement process, the onboarding process is the slowest part. And that's what's holding up projects, not necessarily the delivery, from our end. Or even we know like, hey, we understand. But yeah, if you are a founder, executive director, owner, CEO, decision maker of a health focused organization, we have a free webinar coming up soon on how to just attract consistent funding for your health organization. And you'll learn more about our framework. Something that I designed in 2018 that has helped organizations go from just a few hundred thousands of dollars in revenue a year to millions. Um, and, helping organizations identify that they're saving like at least $25,000 per staff member by improving their approach to engaging with and recruiting people for their health programs, right? Whether it's a health event or a health program, we're showing you how to be most effective and cost efficient while reaching the ultimate goal. And personally, our mission is to help organizations be successful in a way that it benefits them and the community, right? It benefits both parties because we need each other. We need the organization who's providing the program, the resource, the grants, whatever, and we also need our community, right? So we need to do stuff that benefits both the organization and the community, and that's really our approach and our goal for the outcomes. That's why it was personally hard for me at first to I thought would never work in pharmaceuticals, like help pharmaceutical related companies. But it really did change my perspective on it's not always about the type of company. It's also about the people within that company, right? I had a whole thing like, oh, I'm not helping pharmaceuticals, you know, for all the reasons. But then I was like, wait, this organization actually has a mission to serve their community, and they are a pharmaceutical company, and they align with me because my background is in chronic disease and I see exactly what they're talking about. And so it was awesome to really bring their vision alive and to help them be successful for years and still successful. Um, that changed my perspective a lot. I told myself I would never write a grant while I was in college. And I mean, I've like won and managed over $12 million in grants. So you just never know how opportunity comes to you, and you just got to take it and see where it goes. But like ethics and integrity is always at the top of my mind because I don't want to miss out on my blessings in my personal life, let alone my business. Um, and I appreciate when people trust me as their consultant or their coach to help them do something that they think is possible or might not even realize is possible. Um, or that we both were shocked because I've had those experiences as well with clients that I was like, girl, that is awesome. Like, I was thinking here, but it even, like a lot of the times I'm thinking higher and greater than my clients. That's what I'm here for. But when it exceeds both of our expectations, yeah, that's good stuff. So that's what excites me the most. Um, but yeah, check out our resources. We have some free resources. Our health equity guide. It gives you just ways to advance health equity for your programs, your initiatives. This is for-profit and nonprofit organizations and businesses. It also gives you real AI prompts that truly work, not just some BS ChatGPT stuff that you can. It really works to assess your programs. It's 10 different prompts. You can look through it to play with those things and see how you can further look at how effective your programs are being, and how close, not even close, because advancing health equity, I don't think we'll ever achieve health equity because that's just life. But I do think we will continue to move it forward closer to it being something that is more achievable, for people, not so many barriers or like, delay in time, quality, right? Things like that. Um, let's see here. I am downtown Phoenix. My camera, I did not wipe it off. I apologize. Downtown Phoenix. So, just on the patio as my toddler naps. So, I hope everybody was able to hear me throughout this because I did have a mic on. Um, but you guys have a great rest of your day. And I am going to log out.